Buenas tardes a todos, and thank you so much for joining this conference. I really want to thank the El Centro staff. I want to thank Presbyterian for being here. I want to thank people who understand what the impacts would look like. We're here because we think it is incredibly important to make sure that we take the stories of what could happen if the budget resolution that would cut $880 billion for Medicaid actually becomes law. We want to make sure that my colleagues and that the president see what is happening in rural America if you cut these funds. We want them to see the pain that would be caused to families, to mothers who love their children and are just trying to keep them safe and healthy, to clinics who are an important part of the economic lifeblood of rural America. And to those communities. What happens when you lose your healthcare? What happens when you lose your clinic? So I really want to thank Dr. Hayes, Dr. Sandoval, the CEO, all the wonderful, wonderful nurses and doctors and patients and promotoras and health community. I mean, this clinic is great. I've always been a big fan of El Centro and what it does. But let's talk about some of the facts. 47% of El Centro patients are enrolled in Medicaid. That's almost half of all patients. The Republican cuts would severely impact services and workforce stability here. It could put thousands of patients here and across New Mexico at risk. And El Centro is just one clinic that represents and is reflective of clinics across my district. I have incredibly beautiful, culturally rich, with heritage steeped in the land that I represent. Well, those places are the most at risk and the most underserved for healthcare. And they rely on rural clinics like El Centro. And many clinics that look like mine are in Republican areas. They're in Pennsylvania, they're in Texas, they're in Iowa, they're across this country. So this is not a Republican or a Democrat issue. It is an issue of keeping our population safe and doing it in an incredibly cost-effective manner. I'd point out that in Pennsylvania, 45% of the revenue for community health centers comes from Medicaid. In Texas, it's 26%. In Texas, it's a little lower because they refused to expand Medicaid. So many of their working families aren't on it. But still, a quarter of your clinics rely on Medicaid. We know across the country, half of births rely on Medicaid. So if you believe in babies and family values, you should believe in making sure those babies are born healthy. So we're going to hear the stories from the doctors, from the clinicians, from patient. But I want to point out a distinction of what we're doing here. They are looking at cutting $880 billion from Medicaid. And they voted for a budget resolution that does that. And then they say, oh, no, we didn't vote for any cuts. That is so hypocritical because you voted for the budget that requires the cuts. So exactly what they look like, we won't know. We won't know until after they actually come out with them. But they've already told us, we're going to cut for Medicaid. Their Project 2025 said they want to cut for Medicaid. And why? It's not to save money, because we will hear about how what we do here, what they do here in this clinic saves money. When people can get primary care, they're not in the emergency room. When people can get Medicaid expansion and health insurance through Medicaid, they continue to work. That creates money. That is not why they're doing this. They have a vision of the people who rely on these essential government programs. Musk said it. He put it in a tweet. They're parasite class. They're not the parasite class. There are neighbors, there are farmers, there are people who work in the grocery store when you go in there. They are people who work in the healthcare industry. They're the people who care for your children and care for your elderly. They are people we love. They are not parasites. And we're going to do whatever we can to continue to get them their coverage. And let me contrast what the Republicans are doing and how they view people who require these government services because it's infrastructure with what Democrats did. The reason why it would be such an impact in New Mexico is because we did do Medicaid expansion. And when we did Medicaid expansion, we have 266,000 people in my district alone relying on Medicare that might lose some aspect of their coverage if their budget, when their budget becomes law. That's 122,000 children under the age of 19 and 26,000 seniors. Just in my district alone, multiply that for the other two districts. But the other thing we did was we did the Affordable Care Act, and then we recognized that health insurance premiums were too high. How can we bring down costs? Democrats have always been looking to how do we bring down costs? So we did the Democrat insurance premium assistance. And 17,000 people in my district alone will see their premiums go up by $1,090 a year, a 59% increase under the Republican plan. A 60-year-old couple would see their costs increase by $12,000 a year, $1,000 more a month that a couple would have to pay for their health insurance because of the Republican budget plan. Latinos, I'm a Latina, New Mexico is very much of a Latino state, a 700,000 increase in Latinos getting insurance coverage because of what Democrats did. So Democrats have been focused on reducing costs. The Inflation Reduction Act had these kinds of benefits in there. And what Republicans and Trump are doing is increasing the cost of care. We can't afford them. New Mexicans cannot afford Trump and the Republicans. They are costing us lives, they're costing us healthcare, and they are going to cost us more every month.